All right. So today, Searching for Happy's guest is Nina Wilson. Nina, thanks for being a part of the podcast.
Yeah, thanks for having me.
Nina is a licensed therapist. She's a coach and she's a plant medicine facilitator. So she's got a lot going on. And you're located out of where?
It really kind of depends on the day, but I will just say Denver,
Okay.
Denver, Colorado.
But you work in a lot of different states. And
Yes, yes,
okay,
I
great.
travel a lot for work.
Okay, great. So you're involved in Nina and I were talking, and one of the things that piqued my interest is that there's a lot of people that get stuck on the attempt to wean off of medications, and they're a lot of these psychotropic drugs. They get them hooked. They get hooked on these. They try to wean off. They can't wean off. Something happens, and then they have to jump back on. Um, and so I always said, if there is a person out there, a specialist that can help people through that process when weaning off, of what they can do to supplement whatever is happening to their brain. If there's another supplement that they could replace while weaning off and reducing the dose to the point where you can wean completely off an anti-anxiety, anti-medication drug, that person would be a rock star. And you mentioned that you are exploring and helping and assisting people in doing that. So tell us just a little bit about, your background, your journey, how you became, what drew you to this field, and what you're doing. We'll start off right there.
Yeah, so I am a licensed psychotherapist. So I'm licensed in the state of Colorado and the state of Nebraska. So I'm licensed in 2 states. And of course, you start out in social work when you do that, and you work with a lot of populations that are high risk for trauma. And then pair that with, I've had my own trauma. And so doing the trauma work for myself and then really observing these populations that I was working with, by the time I graduated with my master's in therapy, I realized that talk therapy does not work for trauma. Trauma encompasses your entire being. It's very holistic and integrative in nature. And so you need to treat it that way. So
Mm-hmm.
that's how I started. I started by developing a holistic protocol to the treatment of trauma.
Mm-hmm.
Yeah.
Okay.
Then I moved into a space of suicidal ideation, because what my supervisor was telling me about suicide was, oh, if a client comes in and they're suicidal, you send them to the hospital. I'm like, what if they don't need to go to the hospital? They're like, no, it's a liability, send them to the hospital. And I was like, that does not seem right. This is what you're telling me, is that it's either they're escalated to a hospital or here we are. So I dove into suicidal ideation. So trauma and suicidal ideation were my two first expertise in my therapy practice.
Mm-hmm.
Along that way, then I also moved to Colorado from Nebraska, and I moved to an area where a lot of psychedelics were in use at the time. And people were using this because they did not have access to mental health care, and because they didn't want to be on the psychotropic drugs, because if they did successfully get off of them, it was a nightmare.
Yeah.
And then they were reading the research. All of this research is coming out about how psychedelics are so great, but they were utilizing the psychedelics by themselves and then not understanding integration. They're not understanding things that were happening to them. And it was really messy.
So there
And
were
so I was
people
like,
in Denver when you moved to Denver. There were people that were diving into the psychedelics, and
yes.
when you moved there, so you're like going, okay, from Nebraska to Colorado, big difference here. People are actually,
Well, I will say that I did have my actual first experience helping someone integrate psychedelics actually did happen in Nebraska. It's just a
oh
lot
wow,
more of a conservative community, and there wasn't that culture there as much where there was massively in Denver. And Denver, I mean, the city itself is so much larger
yeah.
than anything in Nebraska. So like there's just a lot of different cultural aspects. So then I was like, wow, okay, this is not okay. And so I dove into plant medicine. Along the way, though, I ended up on my own personal plant medicine journey, and then was like, okay, now I'm really studying these medicines because I feel like this helped me so much and I was connecting so much. And so then I added psychedelic integration to my repertoire for
Hmm.
licensed therapist. But
Hmm.
then I also became a coach and a consultant, like a microdose coach. And then I do integration coaching as well, trauma coaching as well. And then I consult with a lot of different churches, like psychedelic or entheogenic churches, on being
Hmm.
trauma informed, suicidal ideation prevention, and things like that. Because those things are really prevalent in the plant medicine community because people are going to this for that. But
Hmm.
then sometimes the facilitators are like, I just really know how to serve the medicine, and there are some things happening here I don't understand and I don't work well with. And so I'm then consult with them and provide trainings for that. So
Right.
that's kind of the gamut of what I do.
Hmm.
However, back to your point about these prescription medications. So what was happening was people were reading all of the research on how microdosing psilocybin can be so great for depression.
Hmm.
And in Denver, it's decriminalized in the city of
Okay.
Denver.
Yeah.
So people have access to it. But they don't necessarily know a lot. So they were reading, protocols online and doing these things. But then the problem is they weren't always understanding interactions with other psychotropic meds. And then also they just weren't being very successful, because even when you microdose a medicine, you still need to do the integration piece.
Sure. Yeah.
So I had all of my clients coming to me like, I want to try mushrooms. I want to see if that works. I want to, I want to get off my psychotropic meds and use mushroom. Like they were all, and I was like, how do I handle this?
Yeah.
How do I handle this? So previously, I am trained in functional medicine for mental health, and I was helping my clients use natural medicine supplements to help them get off of their meds. And it was
Okay.
difficult
Yeah.
because those supplements don't do quite the same things that other plant medicine does. And so,
Now,
but
Nina, was that something you
yeah,
studied in school where you take, there's certain supplements that you can take when weaning off?
so it's a separate training, but it is one that when I chose to create that holistic protocol, I incorporated energy work into my sessions. I incorporated functional medicine into my sessions. I incorporated yoga and breath work and meditation into my sessions. I mean, I was like, there's all these other things that people can do, but we need to bring it together, because if we keep these
Right.
things separated, how it was when I was treating my trauma, all those things were separated, and it took me longer. But
Right.
if once I incorporated it and we were doing it all together, it was working really well,
Hmm.
um, to treat trauma. So I was like, okay, this is what we're going to do now. Like, we're going to do this stuff. So then when I moved to opened my practice in Colorado and all of this was happening, I was kind of like, I don't really know how to handle this. I don't really know what to do. But I will say this about myself. One thing that is super important to me as a therapist is to allow my clients to have their sovereignness. So, like, you are an independent being who gets to make your own choices. I'm going to empower you as much as I possibly can in that. And if you make some dumb ones and there's fallout, then we're going to work through that together. I don't ever want to tell my clients, do this, don't do this. That's not how I work. So
Hmm.
when they were coming to me like, I want to do this, I want to try this, and I was just like, I know this much about it, and we're going to do this. I also started microdosing myself because I really wanted to understand what that was like.
Hmm.
I am a firm believer, and I can't help you if I haven't really been there, because I
Yeah.
don't know
Yeah.
what that's like.
Sure. Yeah.
So,
What are you microdosing with?
so here's the cool part. Of course, because I was in the Denver area, I could microdose psilocybin because there's this weird little loophole with the decriminalization. Okay.
Hmm.
And so I did microdose that for a while, but I actually started, one of my mentors started me microdosing BCAPI, which is the ayahuasca vine. So
Okay. Yeah.
the
Yeah.
ayahuasca vine, BCAPI, does not have any active DMT in it. you have to add another component to make the psychoactive tea that
Uh-huh.
people take when they have when they do ayahuasca. And
Right.
bee happy, so mushrooms act more like an SSRI, and bee happy is an MAOI. So typically they sort of increase the serotonin availability in your brain, both of them, but they do it in different ways.
Uh-huh.
So, and BCAP is legal in all of the states except for one. So I was like, okay, let's see if I can do this, because if I can help provide this for my clients and this is legal like everywhere, this is going to be a lot easier. You know, there's no, oh, you have to be in Denver. I mean, there's no like conversation around any of that. So,
Mhm.
so then I started helping. I bought the BCAPI. I started making the tinctures, and I started helping my clients get off their psychotropic meds with the BCAPI. And then, of course, the mushrooms are still pretty popular in Denver, and so a lot of those clients were doing that. Well, then I'm in these Facebook groups, psychedelics for mental health, you know, plant medicine groups, things like that, and I'm noticing a lot. I mean, so many people having conversations and asking questions about, I want to get off my antidepressants. How do I do this? You know, how do I microdose? I mean, they're asking, do I microdose this? Do I do that? How do I do that? And I was like, oh no, please do this safely, because if you mix the wrong psychotropic meds, if you mix the wrong combination of those plant medicines that are SSRIs and MAOIs with the prescription medications, you really increase the risk of serotonin syndrome
Yeah.
tenfold, which
Yeah.
is deadly. You can
Yeah. Yeah.
die,
Yeah.
right? So, so then I started answering questions in there, and that's how I kind of ended up being a microdose coach, because I was like, okay, well, I mean, I understand that you want off of this, but also, can we please make sure we're doing this as safe as possible?
Yeah.
And understanding, who am I?
Yeah.
Nobody. I'm just some random therapist in the Midwest that was like, okay, but also you need a little more education. And I'm not an expert in this by any means. I
No.
cannot regurgitate all of the literature. I cannot tell you all of the science. I was not specifically trained in this. I didn't go to school for this. But by utilizing what I could myself, utilizing the research that I had available to me, I have been pretty successful in helping a lot of people get off of their medication.
Wow. So, okay. So BCAPI, is that B and then CAPI?
CAAPI.
CAAPI. Okay. And that acts as like an MAOI.
Yep.
Okay. So what is the difference between an SSRI and an MAOI?
So an SSRI or SNRI, those work with the serotonin reuptake inhibitors.
Yeah.
But the MAOIs it inhibits MAOs, which actually, I'm just going to say, in a very non-scientific, because remember, I'm not a science in this area, way that it kind of absorbs the serotonin. So when it inhibits the process of the MAOs, then you still have more serotonin available to your brain.
Okay.
So
And
when people do like the ayahuasca brew, or when they do a macrodose of mushrooms,
yeah.
or even Bufo, because the 5-MeO, the DMT is an
Yep.
MAO as well.
Yeah. Yeah.
When you do that, and then I mean, even like MDMA, the way that works, like that surges serotonin to your brain. That's why people are like, oh, this is so loving. This is so great.
Right.
That's where that love feeling comes from.
Yeah. Yeah. Okay. So, all right. So then you got into microdosing BCAPI because of the legalization of it. It's more prevalent. It's more available to people. Where do you get that at?
So I work with a tribe in Peru.
Okay.
They actually have a retreat center down there. That's how my mentor put me onto them, but that's how I sort of found them. And then I just, because again, Well, I'm going to say again, because this is you and I's previous conversation. So
Yeah.
let me recap that a little bit. I actually am Indigenous, and it's really important for me to honor Indigenous cultures and honor the sacredness of this plant medicine. I
Hmm.
will tell you, you will not get a BCAPI tincture in the mail from me that you have ordered without understanding that this is a sacred plant medicine. This is not just something you're taking and I kind of go off on a little blurb about that.
Sure. Yeah.
Um, so it's really important that this is also ethically sourced, sustainably sourced, and is just honoring that culture and going back to that indigenous space.
Hmm. Yeah, I love that. So the BCAPI,
Mhm.
that's one component of the ayahuasca.
Yep, the
It-
ayahuasca brew.
okay, and the ayahuasca typically, and one thing that I did ayahuasca years ago in Peru, in Iquitos, and had an amazing experience. The only thing I don't like about ayahuasca is the illness, getting sick.
Yeah.
You know, I mean, when they handed me a bucket and then they handed me toilet paper, I said, okay, I'm in for a ride here, right? Because
I'm
in all these, like and this is the thing. I mean, when people do ayahuasca, now I did it with a shaman and a friend. And it was back in 2004 or 5, before the big ayahuasca rush. I
yeah.
never even heard of it. I just happened to be in the Amazon doing something else. And somebody said, oh, you should try this. This is an indigenous thing that can really help heal
Mhm.
you and whatever you're dealing with, whatever issues that you're struggling with. It's a great way to move through that process, and a shaman will guide you. And I said, well, I'd love to talk to somebody about it and possibly explore it. And then I met the shaman, and they kind of told me what it was about, and I said I'd be interested in giving it a try. He goes, come back at 7 o'clock. And I was there all night in this cabin out in the middle of the jungle in the Amazon in Iquitos. So it was about 30 minutes outside of the main city of Iquitos. And I had a really, truly powerful experience. But the only thing I didn't like was that your stomach gets really upset. A lot of people vomit. You get diarrhea, the whole thing. There's a whole purge process, which you don't get with like mushrooms or some of the others.
Well, let me tell you a secret about that. You don't have to purge that way. I have done ayahuasca, I've done ibogaine, I've done bufo, I've done mushrooms several times because it's really big in Denver and I love my little mushies. But
Yeah.
I've never, I've never thrown up. I've never
Wow.
purged that way. Because there's a trick. Do you want to hear the
I
secret?
I do.
The secret is that all that is doing is moving energy in your body. So if you move the energy in other ways, you don't have to vomit. And actually, Combo, which is the frog medicine,
Yes.
I am a practitioner of, and I've used several times. And I honestly, and I mean, like the point is to literally purge with that. And I've
Right.
only thrown up twice, and I've taken it a lot of times.
Hmm.
So you don't have to, as long as you move the energy otherwise. So
Yeah.
with a boga, I scream my face off. Like I'm literally screaming bloody murder for a lot of that time because it's moving that energy. Anytime I feel like I need to um, throw up, or anytime I feel like I'm going to have a lower purge, I just start screaming,
Yeah.
and it moves the energy and then it goes away and dissipates.
Hmm.
And with ayahuasca, because of like my last ayahuasca journey, I wasn't in a place where it was okay to scream. I like just wanted everybody to have the nice peaceful night. And so I just was shaking my body and noisy exhales. And
Hmm.
every time I would feel that, I would just start shaking my body and release the energy in a
Hmm.
different way. So
Wow.
try that next time.
Interesting. That's an interesting tip. I love that. So let me ask you this though. I
Yeah.
mean, if they're all kind of using, a form of DMT to reach this other side. So like isn't there correct me if I'm wrong, is there DMT in ayahuasca, psilocybin, and
No,
no.
no.
Okay.
So bufo, which is the toad,
That's the toad. Yep.
is 5-MeO DMT. So there's
Right.
DMT in that.
Yes.
Yes. And ayahuasca has DMT in it. And then you add the chacruna and it activates the DMT
Right.
when you go through. But that's it.
Okay.
I mean, there's other forms of DMT, but like when we're talking about the plant medicines everybody's using, those are the two, right? And so psilocybin is psilocybin itself. It's its own toxin, I guess is how I'm going to say that, for lack of, again, no science here, not a scientific
Sure.
person.
Okay.
I mean, I read the science and I'm very geeky on that, but I am not a scientist. So just for the masses to know that. The like iboga is ibogaine. That's a completely different component itself. San Pedro and peyote is mescaline, so that's a completely different component itself.
Okay.
But I will also say this: I have done pretty much all of these medicines, and they all take me to the exact same place.
Wow.
So it just is a different route of getting there, and it affects the body a little differently. Like, right, like I feel actually more nauseous on iboga than I do anything else, because it gives you like this weird seasickness that I'm just like, ah.
Yeah. But they're
My
all
favorite
taking you,
medicine.
Nina, they're all taking you to the same place of
Yes.
stuff that you feel maybe that you have to kind of investigate, look at, move through.
So this is my experience. Okay, this is just my experience. And I've had some conversations with other people and they've had this experience. But once you first move through the ego is going to be like, oh, we shouldn't be doing this. Like,
Sure.
there's fear, there's anxiety. And every time I've sat with a lot of medicine, every time fear and anxiety, every time. And you move through the ego and you kind of let it have its voice. It's a part of you. We can't ignore it. Like, let's just be like, yeah, okay, I see this coming up. And then I start kind of the purging process, right? So I start shaking, I start making noisy exhales or screaming, depending on where I'm at and what I'm doing. I start the purging process, and then all of the things, the stuck trauma in the body, because remember, trauma gets stuck in the body and the brain.
Yes.
So you might have the traumas coming up here and be really cognitive, but when you're shaking, or like why you purge, things like that, is because it's purging the trauma from your body, because it's also stored in your body. So plant medicines are extremely somatic. And then it's somatic afterwards when you get home. And that's where a lot of things were happening, where people are like, I don't know what's happening to me. I'm like, I do, it's fine. It's somatic. Let me explain this. But then once you move through the traumas, or like the current crises you're in, I mean, like this last weekend, I was like, oh yes, please help me with these relationships. Got through all of that. And every time when you get through all of that, and if you're not out of the medicine yet, before you can move through that, it always brings me back to my full, integrated, authentic, genuine self, where my human self, my soul self, and my God self are all one. And it is the most amazing and everything, because you are everything and you are nothing all at once. And everything from the moment of your conception as a starseed is available to you. And the medicine shows you, like, you are all of this, and you are nothing, and you are the universe, and you are a soul, and you are a human, and you are a God part, and you are all of these things. And I cannot, if anything, that's always like the best part for me, because I'm like, I feel 100% myself, without any of the conditioning, without any of the trauma, without any of the barriers. My core self, this is who I am.
Yeah.
All of them take me there.
Yeah. That's pretty powerful. But here's the thing. If you can do it without getting nauseous,
yes,
and having to do those tricks that you do. I mean, I hear psilocybin. I've never done it. Doesn't make you sick at all.
Some people it does make very sick.
Oh, it does. Okay.
Oh,
I didn't know that. Okay.
Yeah.
Okay. So you've done them all. So that, like, I was
most
reading
of them. I don't know. I don't think I've done them all. I've done most of them.
Well, so, like ibogaine is out of Africa, right? And then peyote and San Pedro, those are from South America, I believe. What of the psychedelics that you've tried, what ones have been most successful for you?
I think that they all, again, they all take me to the same place. They all help me move my trauma. They all help me somatically purge the things I need to. They all help me cleanse and clear my body.
Okay.
I was literally dying from physical disease when I started this journey, and I'm completely free of incurable diseases that the doctor said I would never have, or I would always have. And like, I would always
Wow.
have to be on these things. That's a whole nother conversation for another
Yeah.
different video.
That
But
that's awesome, dude. We got to have another one just to hear that story.
for me, it's not about which one takes me to a better place. Like they're all so beautiful in their own right. I'm going to say this. They are all so beautiful in their own right. And I will say, depending on kind of the experience you want. So you can go really deep with mushrooms, but it's not, it seems to be more expedited when you do it with ayahuasca. And ayahuasca gives you that serotonin surge. So it's really, really beautiful. But bufo is really quick. So if
Yeah.
you don't want to be in it real, if you kind of want to like go to the bufo is going to be real quick. It's a real quick journey. You're not having
Yeah.
to do it for 14 hours. But
Right.
my absolute favorite, and most people hate this medicine, but my absolute favorite is Ibogaine.
Really?
Hands down. It saved my life in 2 different ways. And it is a rough medicine. She is firm but loving. But it is hands down my favorite medicine.
Wow.
I feel so unbelievably powerful and amazing in that medicine.
Yeah. Yeah.
But that's just it. Like, and there are other things. So I don't prefer the man-made psychedelics. There's a
Yeah.
lot of the man-made psychedelics I
Right.
have not ever done. Or
Well,
more,
bufo is one of them. There's a concern that they're, with the frog and they're extracting so there's a
yeah,
what
you could
there's
get
a there's
CBD pens and all sorts of, I mean, underground, but it's all sorts of, you can get
yeah.
all sorts of I mean, they're doing a lot of, I mean, I know they're working on sustainability, but there's just, I just I don't know if it's my indigenous roots or what, but like, I just need like the really natural stuff. So I will say that, but there are things that are just not people's medicine. Like I know someone who every time she does bufo, she just purges and purges and purges, and not a lot of people purge on that at all. But she's just like, I don't think this is my medicine. I'm like, yeah, probably not. I have
Yeah.
another person I know that like literally is so sensitive to psilocybin that they can't even take the littlest amount without getting an insane amount of anxiety. Right.
Wow.
I'm super, super sensitive to cannabis. So it takes like little to none of that before
Yeah.
I'm just like out of it. Like, so cannabis is probably not really my medicine.
Well, that's a great question then for the viewers. I mean, I guess for the viewers, I mean, it really comes down to a bit of exploration because there are a lot of psychedelics being researched right now by universities across the world, in
Yes.
particular this country, and they're trying to really fast track some of these like psilocybin and MDMA. LSD is being fast tracked now because of all the success that the research have found. But so for people that are viewing this,
Uh-huh.
do you feel, Nina, with your experience and as a therapist working with people and you're moving through this process yourself, is this the game changer? I mean, can people start microdosing? Do you feel that everybody out there that's been work on a Prozac or a Paxil or an Effexor for the last 25 years, can they wean off of that medication and start a process of microdosing plant medicine and still stay healthy, still stay, or even potentially become even more healthy with a reduced level of anxiety and a reduced level of depression in their life? Is that possible in your opinion?
Yeah. So this is a great question because I had these 2 conversations yesterday. Um, One was about, is this the game changer? Is this how this is going to go? I do think so. So and I have been so diligent in my personal and trauma work for a very long time, very diligent. And I could only get so far and I was having a hard time. I did all the mental health around it. I knew I was good enough. I knew I was worthy. I knew I was safe, but I didn't feel good enough. I didn't feel worthy. I didn't feel safe. Can you do that without plant medicine? Probably, but
Hmm.
it is a lot faster with plant medicine. And plant medicine is what helped me. I was like, why am I still stuck? I've been doing trauma work for over 20 years. Like, why am I still stuck? Because I needed to embody it and that somatic purging that the plant medicine does. And then, I help it along because I want to get to that other end. I want to get to that place where it shows me that authentic self. So I want to move it as quickly as possible. So the shaking that I do, the screaming that I do, the noisy exhales, and I do that out of the medicine too, so that I'm keeping the energy flowing, right?
Hmm. Hmm.
Because emotions are energy and you want that flowing. That's all emotions are, energy in your body. You just want that flowing. And so, yes, I think this is the game changer in that. But though, like, how do you do that? Right? Because
Right.
if we regulate it in the pharmaceutical, and this is just my opinion, if you regulate it in the pharmaceutical place, there are a lot of consequences for all of us, and there are a lot of consequences for indigenous tribes in that. And that is not okay for me because
Hmm.
I am very much an advocate for that.
Hmm.
But also, when it's there, I also do see a lot of not so great things happening in the plant medicine community, which is why we're starting the nonprofit that we are next year to help train people in trauma informed and in this suicidal ideation, because it's much different with plant medicine. It's more like near death experience suicidal ideation than regular, is what I'm just going to
Hmm.
again say.
Hmm.
Um, so that train it in that. And then, we have a support group right now for women who have been harmed in medicine, because unfortunately that's happening. You're in a very vulnerable state, and sometimes people are intentionally harming and sometimes people are not intentionally harming. I
In
haven't read
what
those
way? In what way are
stories
they being
myself.
harmed? In what way are
um
they being?
so we actually, there's been a lot of people, women unfortunately, come forward where they have been sexually coerced in the medicine, and they've been very vulnerable and assaulted in that manner,
Okay.
unfortunately.
So
But
these
then
are places that they're going to experience the medicine around
Mhm.
unethical facilitators or people that are
Yes,
just almost predators.
yes.
I gotcha. Okay.
We also though have, and I have my own story of this, we also have a significant amount of people that are being harmed because they're not getting the proper integration, or the facilitator is not trauma informed. And just last Friday, I completely slipped into dissociation and outwardly expressed a trauma that I have been through. And it was terrifying for me. And thank goodness the facilitator was trauma informed and knew what to do with me. And
Okay.
I've done this a lot, right? And I mean, I
Yeah.
knew what was happening as it was happening, but I was dissociated, and I couldn't, I didn't feel like I could control that. And he brought me out of that. So there are things, people being harmed in like very unintentional ways as
Sure.
well, from lack of education. So that's one thing. And if I will always say this, I stand by this so much. Can plant medicine help everyone? Absolutely. Can everyone be helped by plant medicine? No.
Okay.
You have to have the integration piece. You have to do the work. It is not a magic pill. It is not a magic wand. You don't get to, that's one thing about prescription medications, the psychotropic drugs for depression, for anxiety, they mute you. You don't
Right.
have those feelings anymore. You don't have to deal with it. You don't have to do the work. But when
Yeah.
you use these plant medicines and it's really literally bringing this stuff up for you to work through, and you're not integrating, even when you're microdosing, that's a problem.
Well, here's the thing. I mean, I think people are longing for an alternative where they don't have to take a chemical that they're going to
Mhm.
become dependent on,
Yeah.
where they can just take, you know, if there is a plant medicine out there that they can start to take, that they can, I don't know how often you'd have to take it, I don't know, but where they can create the same form of stability that they get from their Prozac, and they can
Mhm.
go to work and still function and do whatever they need to do to cover the mortgage and make the car payment, take care of the kids. If there is a plant medicine that can do that, a natural plant medicine that they can go on as opposed to a chemical, I think people would jump ship
Yeah.
immediately. The thing is though, is there? That's the big, is there? Can people
I've
live like that?
They've been doing it. My clients have all been doing it with the BCAPI and or the psilocybin. And the thing is that you just have to know, like you have to have an educated person in these medicines to help you understand how to do that for your body.
Yeah.
And especially if you're already on something and how to get off of it. But yes, I am seeing that 100% with my clients. And I felt that very much when I was microdosing mushrooms myself, because what was happening was I felt a relief in the depression. B, it was bringing up to the surface what I needed to deal with, so I was able to deal with it. I wasn't just like, why am I feeling this way?
Right.
And then C, the last part of it is like the psilocybin is really magical because it helps really rewire your brain so that honestly you don't have to stay on it. It like literally is trying to get you to get off of it.
So
Like it's
that's
the
enough.
coolest thing.
So that makes that a really powerful alternative.
Yeah.
It's a huge,
But
that's a
it's not
huge,
legal everywhere.
if
So I'm
you
gonna
don't have to,
say,
if you don't have to take that every day or every week, that makes it a powerful alternative.
right.
Yeah. So,
And it doesn't have it's not addictive, and it doesn't have like the additives like psychotropic drugs do. So like I remember one time being on an antidepressant and I was having all of these side effects, and then they put me on like 4 other medications to mitigate that. And then before I knew it, I was taking a handful of medication, and
right.
then getting off of that was a nightmare. It really was a nightmare.
Yeah.
Absolutely. But and then with that, like I mean, could you microdose mushrooms every day? Yes. But do you need to? No. And it's a plant, and your body metabolizes the plant. Your body metabolizes that. Now, again, there are contraindications to these things. And again, psilocybin is not legal. So want to make that clear. BCAPI legal, but there are contraindications for it. So anybody that even orders a tincture from me has to fill out an extensive form. And then if there's something that flags on that form, I'm going to we have to set up a consultation before I will even send you this. I'm not, I mean, I try to be as responsible as I can in that, right? Like,
Yeah, sure.
and most of the time they will every like once a month check in with me and okay, well, how's it going, how's it feeling, like is it working, is it not working, should you up your dose, because that's not an exact science. It's not with pharmaceuticals either, but they think it is, like they
Yeah.
make it an
When you
exact.
said, something about indications, right?
Yeah.
So
Yes.
let's explain to the audience what that is.
So contraindication just means that like different drugs and medications that work with each or that interact with each other that say you shouldn't take this together,
Gotcha.
or physical issues and ailments that also say you shouldn't take this if you have this issue.
Okay. All right. So for people, have you had any experience, Nina, working with people that have been taking Prozac or any of these effects or Paxil for years? And
Yes.
and I gone, I don't want to do this anymore. I'm really open to an alternative. Have you seen successes with people working with people like that?
Yes. There was a woman who was on Prozac for 35 years and
Wow.
got her off of that. And then there was another woman who was on Prozac, I believe, and Effexor
Mhm.
for 15 years, got her off that.
Do you
Yeah.
see people that are taking these and also taking like things like Xanax and Klonopin to deal with their anxiety as well? Do you see people like that weaning off of those drugs as well?
Yes. Yep.
Okay. And
Yeah.
they're having success.
Yes. But what I'm going to say with this is that it's not just go off these meds and microdose this.
Right.
It's tapered down. There's going to be things that I can recommend other supplements to help you with, like,
Okay.
right? Like sleeping, digestive issues, things like that. There are things that and honestly, this medicine, this prescription medicine does like mess with your body. So, always being like, I recommend certain probiotics, things like that, like to help as much as I can. But there is also just parts of coming off of some of those things that you just have to embrace the suck.
Mhm.
And because you have to taper
When
down
you're talking about the withdrawal symptoms.
the withdrawal symptoms.
Yeah,
Absolutely.
yeah. Yeah,
Yeah.
here's my big question though. I mean, if somebody comes off of these medications for a long time and they jump on the plant medicine, and you're talking about, okay, so there's got to be a process of integration, there's got to be a process of doing the work. But the big question is for a lot of people, if once I go off these, I'm not stable. Once I replace it with plant medicine, can I develop a stability like I had on my Effexor so that I can function? I know I need to go and do work and go through some therapeutic processes and explore what I need to explore. But first thing is they want to make sure that if I'm going to dive into this plant medicine, I want to be able to feel stable so that my life isn't disrupted. Can they do that?
Yes. So first of all, please don't just go off your medicine and become unstable and then go on plant medicine. That's like you're starting at a deficit.
So how do you
So
do it? What's the most safe way to do this to
if you can
transition?
taper down, and again, I am not a doctor,
Okay.
right? I'm just a therapist that
Yep.
has helped some people with this process. So take this for what it's worth. This is not medical advice. Okay. But if you can taper down those medicines to where you're low enough to then bump up right against plant medicine. But
Okay.
when you're tapering down and you're getting to these lower things and these withdrawal symptoms are really starting to suck, that's when you implement some different supplements, some different lifestyle things. That's when you start doing the work. And then you're already doing the work with those lifestyle things, supplements, whatever, when you start this. And then this, you don't stay on this forever. Like, I mean, this is just like made not to stay on forever. Like, I don't know how to explain that. It's just this beautiful thing. But then you kind of taper down all of that, and then you're off of it. But never going off to where you're in an instability, because that's you're almost swinging the pendulum quite the other way. Now, I've had people do that. I've had people contact me, be like, I hated my meds. I just went off cold turkey and now I'm having all these things and now I need, and that's okay. We can work with that. But if you can avoid that and start working with someone prior to going completely off of this, before you start this, so that it's all kind of really cohesive, that is ideal.
So you're
That is
saying, so
absolutely
what
ideal.
you're saying is coming down, so you're weaning off of Effexor. Let's say somebody's taken Effexor for 20 years and okay, so now they're lowering the dose. They're starting to feel the withdrawal sensations. Then the doctor, their physician or psychiatrist tells them, okay, reduce the dosage again the following week. You're coming down a little bit lower, and then the withdrawal symptoms intensify. Then you're saying once you get to a low dose, implement a plant medicine at that point.
We'll implement supplements and things to help with the withdrawal symptoms, because that's the other thing that happens a lot of time.
So not plant medicine, you're talking supplements.
Not necessarily plant medicine yet.
Okay.
Now, can you have people I'm not going to say can you have people been on low doses of their medication, implemented plant medicine and kind of just went that way and then went off? Yes.
Okay.
But again, I'm not a doctor. So but I'm saying, like, implement some different supplements to help with those withdrawal symptoms. Once those withdrawal symptoms start working with someone then on getting those supplementation, so that you're not like in a hole before you start taking plant medicine. If you're in a hole, can plant medicine help? Absolutely. But what I'm saying is like, if you don't have to do it that way, then don't.
So Nina, what supplements do you recommend when weaning off those types of psychotropic drugs?
So there's a handful of different supplements that can help with sleep. I use melatonin as a last resort.
Okay.
That's usually everyone's like absolute go-to, but I use melatonin as a last resort. and this is just what I have helped people with in the past, and everybody's individual. Again, I'm not a doctor or a nutritionist or any of that. Just trained in functional medicine for mental health. I have used Mexican Dream to help people sleep, which again is another herb, and it's a plant medicine. I have used like valerian root for that. I have had people use cannabis for that. That actually has worked a lot better in the past than melatonin. Just different things like that, because we kind of then become dependent on like melatonin. I
Sure.
was very dependent on melatonin for a really long time. And I was so exhausted during the day. And I realized it's because I was taking so much melatonin at night to sleep
Yeah.
that I was really high in melatonin during the day. So I was just tired all the time.
Right.
It was not helpful. It was not a restful
I've
sleep.
heard of all of those, but Mexican Dream. I've never heard of Mexican Dream. What's that?
Yeah. Yeah. It is an herb from Mexico that helps with lucid dreaming. I got it because I was like, ooh, that might be fun. Lucid dreaming, like I already lucid dream a lot, like on my own, but I was like, is this going to enhance that? But then what I was noticing is that it actually like you have to take a lot of it in order for it to have too much of an effect.
Hmm.
But at lower dose, like it helps me sleep. And I was like, oh, and I was using cannabis to sleep for a while after I went off the melatonin. Because remember, I was really sick at one point. And so this
Hmm.
is how all this supplementation happened.
Yeah.
But then the problem is that I'm super sensitive to cannabis, and cannabis, I can't sleep like that all the time. And I was having some effects from long-term use of using that to sleep. And when I say long-term use, I say like 6 months.
Yeah.
And so then when I was like, okay, I'm going to use the sleepy time teas, I'm going to use valerian root. And then I also found this Mexican Dream and I was like, oh, I can use that.
Hmm.
Blue Lotus will help you sleep a little bit as well too.
So,
It's just it's not as good as.
and these are all great supplements because of the withdrawal symptoms a lot of times from
Yes,
SSRIs
yes. And we
is
want
insomnia.
yes, that's one of the main ones. That's why I started there. But then there's a lot of gut issues that happen. And so you want to, like make sure that you have a really good bioavailable kind of, well, depending on the concentrates. If you are sensitive to histamines, you want to stay away from the ones that have the histamines in it. But a bioavailable probiotic, maybe one that also has a prebiotic with it. And
Mhm.
then like hormonal issues. A lot of people will have hormonal issues because your gut health is messed up from all of this. And then that messes with your hormones. Men, I haven't seen, or maybe my clients have not talked about their hormonal issues as much, but women for sure. And then that comes very much with their menstrual cycle. So
Mhm.
making sure that you're adding in some supplements to support that, because
Mhm.
that can be really kind of insane for women. And I can only really speak to that because I am a woman. But
Yeah.
and so there are just these other supplements that can really kind of help. There's some different like nootropics, which are amazing, that can help you really focus your brain, which are like
Yeah.
lion's mane and chaga and turkey tails, other beautiful mushrooms that we have available to us. But nootropics can be really, really helpful. Adaptogenic herbs can help us calm ourselves and help our
Mhm.
body adapt to stress. So there's a lot of different things that we can implement to help as much as we can.
Yeah.
We can't always take them all away though. Unfortunately, some of it you have to embrace the suck and kind of get through it.
Yeah.
And if it's too sucky for too long, then we definitely reevaluate. Like,
Hmm.
is this what we need to be doing? And has this been successful for everyone? No.
Right.
Like
Do you think that some people are just going to be stuck on SSRIs? Some.
potentially,
Yeah.
potentially. I mean, there's so many factors in whether it's successful or not. And it's not just your biochemistry. I mean, it is that, right? But it's not just your biochemistry. It's not just your support system. It's not just your motivation. It's not just your trauma history. It's not just, do you have other diagnosis, like ADHD and those things. It's not just those things. It's all of it together. And that's where it gets a little complicated sometimes.
Yeah. And I've heard that with they're a little leery about doing research with bipolar patients because of the mania. and
Yes.
how some of these psychedelics can potentially trigger mania.
Yes. I've seen that actually happen
Okay.
before. Scary. It's really
So
scary.
I'm wondering if there is a, if these medicines can help people that struggle with bipolar. If there's
Right.
another way
To do
to
that.
induce it, if you do the smaller micro dosing, and after there's enough, I guess it's like it's the Wild West in a way, right? Because
Yeah.
everybody's exploring. And now people are microdosing things that you never even thought about. What do you do? You're microdosing this? So, and it's a really great idea, right? Because now that you can sample things and take them on a regular basis, but in really small doses to see if there's any kind of medicinal benefit to it over
Right.
time,
Right.
and trial
Yeah.
and error. But yeah, and I guess if you feel like you're getting close to a place of becoming disassociated, then you could pull back or wean down the amount that you're taking. Because I'm guessing, like I've never done any of the plant medicines other than the ayahuasca, and I'm really interested in exploring. So for somebody like me and many others like me, where do you start? You want to start
Yeah. Yeah.
diving in, and you want to do this to find out if this is a game changer for you in managing your stress, managing your anxiety, managing your depression.
Yeah. So anybody thinking about, so I'm going to start with anybody thinking about going on a big journey with the medicine. If it's something that you can get a hold of to microdose first, I suggest that. That's going to
Okay.
help you understand how your body chemistry is going to react to that medicine a little bit more. I microdosed BCAPI for a long time before I sat with ayahuasca in its full form. And it was really helpful because I
Okay.
could kind of understand like what that was like. And you can get the benefits out of the plant medicine microdosing just as much as you can out of the big doses. It happens in a different way, right?
Mhm.
So it's kind of depending on how you decide to do that. With microdosing, I mean, yes, it's kind of the Wild West. Yes, you kind of find what medicine works for you. So if you can find a facilitator or a coach that is very knowledgeable in what you think you want to microdose, or if you can find someone really knowledgeable in multiple, so then you can be like, I don't know what to do, but I kind of want to do this. So like how? Work with someone who has some training and some knowledge the
Mhm.
best you can and vet them a little bit. Like, what is your training? How did you learn this?
Mhm.
Are you formally trained? Did you just sit with ayahuasca one time and decided that you can do all of this for other people? Because
Right.
that's a little sketch, right? Like,
Right.
how did you come about that? And then also asking, and I mean, this is super important, whether you're going to, and ask that whether you're going on a big journey or you're microdosing. That's very important still, right? Find out, well, do you know if they're like, if someone's, I know a lot of cannabis coaches. And if someone's a cannabis coach and you say, okay, well, do you know if there's contraindications with cannabis and anything like a medication or something? And they're like, I don't know. Okay, that's probably not someone to work with.
Yeah.
Understand that, but then also understand, well, what is the support for me if this is not working, or if this is something like my right toe starts hurting after I take this? Like, do you offer support for that? Do you offer coaching for that? Do you,
Mhm.
and then what also happens if like I get stuck just at any point? Like, do you offer support for that? So very important to understand those pieces when you go to work with somebody. But
Right.
I would suggest working with somebody. Now, can you pick these up on your own and do it? I'm not the police. If they're legal
Sure.
to, like, sure. But also making sure that you know who to call if that's not going right, like
Yeah.
have some resources,
Yeah.
do some research. There are a lot of really great Facebook groups there. I mean, some of them are really great in certain ways, some of them,
Yeah.
again, it's the
Yeah.
Wild West, so not so much, but just feel that out and understand that for yourself for sure. And of
Mhm.
course, like, contact me, send me an email. Do you think you could do this? Or I
Right.
am in this area. Do you know anybody in this? Or I want to take this. Do you know someone who knows something about that? Sure. I can help you out. I'll send you back an email, like,
Hmm.
and I'm not even trying to get my own clients, but like, I want
Oh,
people to be safe with this. This is the absolute most important part, is to be safe with it,
well,
right?
yeah, absolutely. I mean, it could be you just brought up a really valid point. I mean, you can explore on your own, and there are people obviously that do that. But if something starts to happen, like you said, and it's unexpected. You made you said, like, if your toe is hurting, but I mean, like, for example, I think you could get, like, maybe something happens where your heart starts racing, or
Mhm.
you're whatever that is, and you're like going, is this normal? Who do I talk to? There's nobody around because I'm
Right.
here in my room alone exploring with this stuff. So you're right. It's good to have people around you that understand what these medicines do and what people actually go through and experience.
Yes.
That's what the shaman do with ayahuasca in the jungle,
Mhm.
in the Amazon. They guide people, and they know what to expect. Well,
Yeah.
and that's where, and if you, it's interesting because now there's a lot of retreat centers all over that are working throughout the Amazon, and they're
Yeah.
profiting big time off of ayahuasca because it's become so popular.
Well, I mean, and it does help when you do
It
it
does.
right. And
It does.
when you do the integration, the medicine is nothing without integration. If
Hmm.
you go sit with the medicine and you're not integrating what you have learned and discovered and bestowed upon you, and it's not actually going to change your life. It's not actually going to be all that helpful, because it's just
Hmm.
like this beautiful moment of, aha, cool, and then you like move on. Like, it's like, oh, a pretty flower, cool, and you move on. So the integration is really, really important, but it's because also, I'm going to tell you, I saw this during the pandemic. I was living in Colorado, and there was such an issue with the need for mental health care. And
Yeah.
it's not that there isn't plenty of us therapists, but the access is lacking.
Yes.
And that's why so many people were coming to me with, I've tried these psychedelics and this plant medicine, and now that's really messed me up. And so, but you know what? I needed to do something for my mental health. So here we are. And I was like, this is a nightmare. And I
Yeah.
knew nothing,
Yeah.
nothing about psychedelics or plant medicine before that. Like,
Yeah.
I didn't do this stuff in high school or college or any of that. Like, I knew nothing
Right.
prior to that. And then
Yeah.
all of a sudden, all these people are in my office, and I was like, okay, I'm gonna have to go get trained because I don't know what's happening.
Right.
And then, like I said, I ended up on my own journey, which was a beautiful and amazing thing. So
Yeah. Yeah. So you're positioned in a really good place.
yeah,
I mean, you're a licensed therapist, you're a coach, and then also you've moved through these medicines and understand the power of them. So yeah.
I do not use a protocol, a modality. I do not literally use anything with my clients that I have not firsthand experienced myself,
Hmm.
because I just feel that responsibility to my clients.
Yeah.
Like,
Well, I think it's important. There's power in, like, there's power in the peer movement, right? So the peer is like a person who can
yeah,
identify with what you're dealing with. Remember, I told you about that before we started recording. I shared a story with Nina about, my struggle with performance anxiety, and seeing all these different therapists until I went to Albert Ellis, of all people, at 88 years old. And Albert was one of those guys that immediately he could relate to me, and he said I dealt with the same type of social anxiety. And then
yeah,
he broke it down in a way that I was like, yes, that's what nobody understood. And then he'd say something else, and I'm like, oh my God, this guy understands what I'm feeling and what I'm dealing with, and nobody else could. There's a power in that. And if you really, I truly believe, if you really want to be effective, you gotta move through your own stuff personally, come out at the other end, because that's how you help people, is when
yeah.
you move through a process, and you work through it, and you make it through it, and then you have some wisdom there to
Yes.
provide to your clients.
Yeah, I don't think I would be an effective trauma therapist if I hadn't had a significant amount of my own trauma.
Yes.
I know for a fact I wouldn't be an effective suicide prevention had I not had my own suicidal ideation. I would not be effective in integrating people from ayahuasca had I not sat with that. And
Yes.
that's very different than people who sit with mushrooms. So
Mhm.
the integration's a little different because it's a different medicine. So had I not sat with some of these, I don't know that. And there are some that I'm like, I'm not good in the integration of this one because I didn't really like my Bufo experience didn't go very well. And
Yeah.
it was actually traumatizing for me. And luckily I found someone to work through that trauma with me. And I haven't sat with it again yet. And I'm like, okay, I'm going to, because it wasn't the medicine, but I'm terrified, right? Still,
Sure.
I mean, I've worked through the trauma, but I'm like, I don't want to have this experience again. So
Yeah.
I'm going to do that. I'm still working through that. I'm going to do that. But I don't think that right now, am I effective in helping someone through a Bufo integration? No, I'm not. So I will refer you. Like if you're coming in and you're like, plant medicine integration, but I did Bufo and that was it. And I'm like,
Yeah.
oh, let me send you to this person.
Right.
Right. So it's also about like having that network of people to refer. And like
Well, what's interesting about that though, too, it's like Bufo isn't a plant.
no, no.
It's the only one out of all of them that doesn't come from a plant, right?
Well, combo doesn't. Combo's not psychedelic though.
Okay.
And like cacao is a beautiful plant medicine and it's not psychedelic, but it's one of my favorites.
What is it called?
Cacao. It's
Cacao?
just ceremonial grade cacao, which is like
Hmm.
the cocoa bean.
Okay. Oh, yeah.
Yeah.
Yeah. Okay.
Very sacred plant medicine, very beautiful, very heart-opening, amazing. It's one of my favorites.
Wow.
Yeah.
Well, so we've covered a lot. Is there anything else you need to add to this before we conclude our chat?
Yeah, I think I just want to reiterate.
Okay.
I'm just a licensed therapist from the Midwest that I was seeing these things and have had these experiences. I'm not a doctor. I'm not a nutritionist. I understand the science when I read it because I'm geeky and I like the science, but I'm not a scientist. So also take that for what it's worth. Take all of this for what it's worth. And the other thing that I think is just super important is I'm not an advocate for plant medicine. I'm not an advocate for plant medicine. I'm an advocate for you need to do what feels best for you. Just make sure you're doing it safely. And there is education out there. There are people out there. There are, ways to do these in very safe ways.
Yeah. Well, Nina Wilson is a licensed psychotherapist. She's a coach. She's a plant medicine facilitator. Thank you, Nina. Man, this has been a great talk. I thank you so much for sharing your wisdom with us. This has been terrific. And share all your links. We'll put all your links at the end of this so that people can reach out to you. I'm going to reach out to you. We got to do this. Actually, I want to do this again too. So, so that we can talk about some of these other plant medicines that you're working with too in more detail. But thank you so much, and have a great rest of the evening.
Yeah, thank you. You too.